Good evening, everyone. Before we begin, I just want to point out that we are not wearing masks, but we are socially distancing and over 6 feet apart. I want to thank everyone and welcome you to our virtual community town hall. My name is Judy Trelevis. I'm the Chief Operating Officer of Mount Sinai Queens and longtime community member. In fact, I know many of you on this town hall tonight. I raised my children here, and now my grandchildren are being raised here. I have an insider's understanding of our terrific community, and I bring that to my job every day. This evening, I am joined by Karen Schwab, Executive Director of Mount Sinai Queens, and Dr. Dana Mazo, Hospital Epidemiologist, Infection Prevention and Antimicrobial Stewardship, and an Assistant Professor of Infectious Diseases at the Icahn School of Medicine. Together, we are going to give you a look at how Mount Sinai Queens managed the unprecedented challenges of COVID-19, and more importantly, the changes we have made to ensure that all our patients are safe when they come to Mount Sinai Queens for care. Again, thank you for joining us. Please welcome Dr. Dana Mazo.
Thank you, Judy. And thank you all for joining us as well. I'm really excited to have this opportunity to share with our community everything that Mount Sinai Queens did during this very difficult time. What we did is we really worked to help protect the health of our community that was so hard hit by this virus. So as you see with the numbers on the slide, this is where we are right now. Worldwide cases are over 9 million. Over 4 million have recovered, and sadly, there have been over 480,000 deaths. As you look at this map of different countries around the world, the red spots show how many cases there were in each of these countries. There have been cases in almost every country in the world, but as you see over New York City and the East Coast of the US, there were so many cases that the red circles blur together. We were the hardest hit area in the United States. In the US, there have been over 2 million cases. Over 740,000 people have recovered, and sadly, over 120,000 deaths. We were the surge. We had the most cases at the beginning of the outbreak in the US. As you probably are hearing in the news, sadly, other states, other areas are having their own surges right now. Next slide. So as you see for New York City, this is all data from the New York City Department of Health. We've had over 200,000 cases. About a quarter of those patients were hospitalized, and deaths were about 17,000 deaths. Remember, any data about cases for New York City undercounts mild cases, because at the beginning of our surge, we had a big increase in cases. We were not testing people who were not admitted to the hospital. We had so many patients in the hospital, and we still at that point were increasing our ability to test, that we could not test people if they didn't go to the hospital. So remember, the New York City numbers will undercount mild cases. So as you see with those graphs, the cases and the hospitalizations, we had a very steep increase starting in the middle of March through the end of March. And we had that plateau, that surge that all of us felt, that all of us experienced in the city. And that was the last week of March through the first week of April, and then had a slow decline that still continues. As you see, the same trend of a steep increase and a plateau and then a decrease was also seen at deaths a week later. The pink map is a map of cases by population. It is divided up by different neighborhoods, and the darker the pink, the darker the purple, the more cases were in that neighborhood per the population of that neighborhood. As you see, the darkest purple are the areas that are just to the east of us, East Elmhurst and Corona, and that where we are, right in Western Queens, is a little bit more, is not quite as purple, but is still a dark pink. So our hospital serves all of these surrounding communities. We were really one of the hospitals that treated the areas where New York City was hardest hit. Next slide. And this is a graph of the cases that we had at our hospital at Mount Sinai Queens. And as you see, it very much follows the trend of what was seen for the citywide. The blue are confirmed COVID cases. The pink is what we call patients under investigation. So they either are patients who we tested and the test we haven't gotten the result back yet, or the test came back negative, but our still clinical concern was so high that we left them as being concerned. And then the gray is patients that we had transferred. As you see, we also had a huge increase that mirrored the city starting in the middle of March. We had our plateau at the end of March and then through April, and now the cases have gone down. And I'm quite happy to say that for the past 2, almost 3 weeks, we have had single-digit cases. Our number of cases has gone down so much in our hospital, and we all feel very relieved, both for the hospital, but also for our surrounding community. Next slide. One of the big developments that happened during the COVID surge was that we had clinical research at Mount Sinai Queens. As you all know, Mount Sinai Queens is a community hospital. We are a hospital that serves the people around us. We are associated with the Mount Sinai Health System, which is a larger academic health system. And from that association, we were able to do clinical research here. This was really important during the surge when we are treating a brand new virus that we don't have the data, we don't have the approved treatments. And we made sure that we had clinical research here at Queens so that our patients in Queens could benefit from what people were learning and trying to figure out to ensure that our patients could get the treatments that they needed. As you see, we did clinical research with remdesivir, antiviral medication, convalescent plasma, antibodies from patients who have recovered, and then also with some other treatments we call proning, having patients lay on their stomach to help their breathing, anticoagulation, which is to make your blood thin, so to prevent blood clots, because as we learned, there were a lot of complications with blood clots from COVID. And then steroids and tocilizumab are both treatments that help to calm down the inflammation, which is what often causes a lot of problems with COVID. You perhaps saw on the news about steroids. A type of steroids was the first study, was one of the studies that showed improvement in death. We have been using steroids here in Mount Sinai Queens since way before that study came out. We had the opportunity to do this clinical research to help our patients. Next slide. And as you see, this resulted in saved lives for our patients. We had over 400 patients who have been discharged, of COVID patients who were discharged because of the care that we gave them at our hospital. Next slide. We're going to show you a video from one of those patients. We're going to show you a video from one of those patients. It's actually a patient, it was a mother and daughter who were both admitted to our hospital with COVID, and they were very sick. They needed high levels of oxygen, including masks to give them oxygen. And we were so happy, and they were so happy when they were able to go home less than 2 weeks later, not requiring any oxygen.
Hi, I'm Dr. Boyce. I'm here with Cindy. She came to us with COVID pneumonia and she was very, very sick. We were all very worried about her, including herself. And luckily she qualified for a trial of remdesivir, as well as convalescent plasma, and of course all the other supportive therapies. We saw a complete dramatic reversal, and she seems completely better. How do you feel?
When I come in, difficult to breathe. When I use the medicine, I feel much comfortable. I can, breathe easily, and just like fresh air go to the body, have the strength. The beginning, I don't want to eat at all, but after 2 days, I started have an appetite.
Good. Mm-hmm. Yeah, we all were really very concerned about what was going to happen, and it seems like everything is better.
Yeah, I appreciate it. Thank you very much.
Yeah, you're welcome.
The role that I played in the care for the Wrong family is I was part of the team that ensured that they got access to the experimental medicines that we have for COVID. They both received remdesivir, convalescent plasma. Hard to know if those medicines are necessarily what made the difference, but the most important thing is that both of the women are doing better, and they're leaving here without any oxygen and feeling, much more like themselves.
Thank you, Dr. Mazo. That was very informative and heartwarming. Now I have the pleasure of introducing Mount Sinai Queen's Executive Director, Karen Schwab.
Good evening, everybody. I'm really delighted to be here tonight with my fellow panelists and all of you. And I'm incredibly proud of the team at Mount Sinai Queens and their heroic work throughout this pandemic. We learned a lot, some of it Dr. Mazo shared, and we felt incredibly supported by the Mount Sinai Health System. So we go to the first slide, please. So here are some highlights of how we managed throughout the pandemic. One of the critical aspects for us was being able to maintain a supply of PPE, that's personal protective equipment. You've probably heard a lot about it. It was in the news because of the severe shortages that had been reported, as well as shortages around ventilators. The good news for Mount Sinai Queens was that we were fully supported with PPE and ventilators so that we were never without. We were incredibly lucky that there were several board members from Mount Sinai who really stepped up and helped create strong resourcing and a supply chain for us that included even sending a plane to China in order to make sure that the Mount Sinai Health System had what it needed. We couldn't have gotten through this crisis without receiving a lot of outside support. There were over 150 additional staff members who joined our team in order to help supplement the resources here at Mount Sinai Queens. Many of them were reassigned from other positions throughout the Mount Sinai Health System, as well as from right here in Queens, because several of our operations, as you know, had to close during the crisis, and we were able to redeploy those individuals back to help us in the inpatient units, as well as to provide a lot of important services throughout this crisis. For example, we had a couple of physicians who were assigned to stay in touch with our family members. As you know, during this period, visitors were not allowed, and it created an enormous amount of anxiety on the part of our patients, as well as the family members who couldn't come to the hospital. So with this additional physician resource, we were able to make sure that somebody was always able to stay in touch with family and support systems to keep them updated on the patient's condition. Next slide, please. So we couldn't have managed all of the patients that came to our door without significantly expanding capacity here at the hospital. In terms of our emergency department, we created additional surge space, as we call it, in tents that were outside the hospital, and you can see a picture of one of them that sits outside the emergency department. And we also had to create additional inpatient capacity. So we significantly expanded our intensive care beds, going from 8 to 32 beds, which was a huge challenge for us, but we were able to do it, and it was important to do it because it wasn't just that we were getting a large number of patients, but the sickness of the patients when they came in. Many of them were critically ill, and so we needed to be able to create the highest level of bed that we could right here in Queens. And we also added additional med-surg beds in order to take care of the growing volume of patients that you saw in Dr. Mazo's slides, where you see how we peaked significantly, particularly during that early stage in those first couple of weeks. Next slide, please. So here's the inside of one of the tents that we used to take care of COVID patients. That's actually a picture of Judy and me. And if we go to the next slide, please. And this is what it looks like today. One of the great opportunities that we were able to take advantage of is took a space that was used for caring for COVID patients, and we were able to make it into a space where our staff could go to de-stress, to relax, and to recharge. And we're incredibly grateful to the outside support that made this possible. It's so important as we go through the recovery phase and toward the end of the pandemic that we not only take great care of our patients, but it's so important that we take great care of our staff. So we brought in an enormous amount of support in terms of mental health staff to be able to provide comfort, support, and resources to our staff. And this is just one more gift that we were able to share. Next slide, please. So one of the primary goals of tonight's town hall is to urge you not to delay needed health care. Hospitals like ours spent 2 months convincing you to stay away unless it was a true emergency and you really were in need of hospitalization. And now it's so important for us to be able to tell you, don't delay needed care. It is safe to get back to Mount Sinai, Queens. The CDC has also reported a significant underutilization of important medical services during this time. So we're all very worried about the impact of that delayed care. There is a recent New England Journal of Medicine article that reported on delayed care and the impact on a community in Massachusetts. It's a relatively small study, but it did show that EMS reported that there were many more cardiac arrests taking place in the field than we would typically see. And unfortunately, stroke patients who had delayed their care to the point by the time they arrived at the hospital, it was too late to be able to administer life-saving or quality of life-saving treatments. So it's so important right now for you to talk with your physician about any delayed care that you experienced during this time. As New York is opening, your healthcare really should be top of mind, not just as you go about your day-to-day, but also for priorities that you put on hold. And if you did put off screenings or treatments or surgery due to the COVID-19, your new normal should be to make sure that these treatments are top of mind. And so for people who may have delayed cancer screenings, even including mammographies or treatment, if you were in need of a heart procedure or any cardiac testing, for orthopedic care, including hip or knee surgery, sports injuries, back pain, we encourage you to please have a conversation with your physician and make sure you don't delay care any longer. Next slide, please. So our services are open now, and we're delighted to share all of the services that have been reopened. Many of them starting in early May, some of them as of the middle of May, but we are doing services at our outpatient imaging area, in our stroke center, where we do spine procedures as well as angiograms. Of course, the acute area of the stroke center remained open throughout the pandemic for patients who needed thrombectomies. Pre-surgical testing is open for those patients coming for surgery or interventional radiology or endoscopy. And you will see changes in the hospital than you might have experienced previously. So for example, any patient now coming for a procedure that requires moderate sedation is required to get a COVID-19 test within 2 days ideally, but no more than 5 days prior to that procedure. Mount Sinai Doctors Astoria, which sits in the pavilion on 2 floors, is now fully operational. They are doing in-person visits, but importantly are also continuing telehealth visits, which were done throughout the crisis, as well as telephone visits for those patients who are unable to do telehealth, but also not yet ready to come back to the hospital. And you can see the range of other services that are now available, including all elective surgery. Next slide, please. So if you do come to the hospital to have a procedure, there is an enormous amount of information that is available to you. This is an example of one of the brochures that you'll receive when surgical testing, which will answer all of your frequently asked questions, as well as prepare you for how to keep safe, what to expect, and how to prepare. And all of this is posted on our website, all designed to keep you up to date. Next slide, please. So here are some of the many things we're doing to keep you safe. One, and I'll speak to this a little bit more, we're continually disinfecting all areas of the hospital, particularly frequently touched surfaces. We are requiring all patients who come to the hospital, all outpatients, to wear masks, as well as our staff always wear masks within the hospital. We're following social distancing protocols, so we're urging people to remain 6 feet apart. We're screening all outpatients who are coming to the hospital at our entrances. We're doing symptom checks as well as taking temperature. And we've also implemented strict isolation practices in order to separate patients who may remain in the hospital from all of the. Next slide, please. So, ensuring your safety is our highest priority. All of the environmental services have been stepped up to make sure that we're cleaning to the highest of standards. This includes making sure, as you can see in these photos, that we do all repeatedly with bleach, whether it's at the bedside, whether it's doorknobs, whether it's elevator buttons, chairs in our emergency department or our exam rooms. And we also use ultraviolet equipment in our rooms, bathrooms, and ORs to kill any possible bacteria or infection. Next slide, please. Again, for ensuring your safety, we have a separate entrance for any patients who are coming for an outpatient service. We are, as I mentioned, screening all patients at our front entrance, and that includes a symptom check as well as taking your temperature. We've reduced seating in our lobbies as well as all of our waiting areas. We're limiting appointments to make sure that we don't keep you waiting. And we're attempting and facilitating getting you back to an exam room or a procedure area or an OR as quickly as possible. Next slide, please. So we were fortunate that Mount Sinai Queens as well as Mount Sinai Manhattan were selected out of about 20 hospitals across the state to pilot reintroducing visitors into the hospital. And over the past month, in terms of this pilot, more than 1,300 visitors have come to the hospital, and we've done it safely. While we've been able to protect our staff, patients, as well as protect our visitors, we know how stressful it can be for patients and their loved ones when they can't be together. The pilot was incredibly successful, and as of last week, the governor expanded it to all hospitals across the state. So again, just like we do for our outpatients coming to the hospital, we do a symptom check and a temperature check for visitors at all of our entrances. There is only one visitor allowed per patient at a time, and there are a maximum of 4 hours allowed daily for any patient in the hospital. And if you're coming for a procedure, whether it's an operating room procedure or an endoscopy or an interventional radiology procedure, we do allow, and the state allows, one companion to accompany you to the procedure and wait for you until the procedure is completed. Next slide, please. So here's good news at home, right? New York is opening. It has been frustrating to see infection rates climb in other states as well as across the country. These trends are a reminder that we won't continue normalizing here. The pandemic is far from over. And now more than ever, vigilance is really required. So we urge you to be an advocate by washing your hands continuously, staying home if you're sick. Tell your friends and neighbors to stay at home if you're sick. Make sure you practice social distancing wherever you are. And please wear a face mask when you're in public. We see a lot of people walking around and sometimes they have face masks covering their neck. Well, that's not going to do a lot of good. Or they may not have it covering their nose, but just over their mouth. Please make sure you wear a face mask in public. Make sure it covers your nose and your mouth. There are some new masks that are out there that have an exhalation valve. You'll see a hole that looks like a valve at the bottom of the mask near your mouth. Please don't wear those valves. They put others at risk. So we encourage you, wear a scarf, wear a bandana, wear a surgical mask. But please don't wear the exhalation valve masks. Thank you very much. Next slide, please. We couldn't have done it without our community. Your support has really meant so much. We're fortunate to have donations from more than 250 restaurants, other organizations that amounted to about 30,000 meals over the course of the pandemic, which allowed us to provide lunch and dinner every day for our staff. We were incredibly touched by the many letters and notes that came from the community. And you can see some of the comments here that were written from our staff. And most importantly, the cheering and the clapping that continued to this day at 7 o'clock. People line up across the street from the hospital. They shout down from the windows. They play music, honk as they go by. It's one more reminder to our staff that the community does care and appreciate everything that they've done throughout this pandemic. Next slide, please. In closing, let me say that as a hospital and as a community going through a really difficult time, we just heard about the impact of COVID-19 on New York, Mount Sinai Queens, and about our efforts to adapt to the new normal. Even the good news of reopening, getting back to work, is diminished by the rising number of COVID cases we see in other parts of the country, and specifically in several of the states. And then, several weeks back, we witnessed the killing of George Floyd and the callous disregard for his life when the officer who killed him and those who stood by and watched him in silence. 8 minutes and 46 seconds is a long time. It's plenty of time to think about the injustices in our country. Many of us are thinking and feeling it quite personally. As a hospital and as a health system, we're also thinking and talking about what we're seeing in the Black Lives Matter movement. It's a period of self-reflection and examination for our nation. All of us at Mount Sinai Queens, we hope to serve as a leader in improving access to healthcare and address in a meaningful way racial and ethnic disparities that may impact our nations. We're also focused internally on how we can break down any barriers that prevent equity and inclusiveness. For us, this movement inspired a community. I came to Mount Sinai Queens 21 years ago, and we've taken enormous pride in the diversity of our staff. This hospital is rooted in our community, and it only makes sense that one of the most diverse neighborhoods in the world should have a hospital whose staff reflects that diversity. So we're going to keep supporting each other, practicing our values every day, celebrating our differences, and listening to each other and educating ourselves. We hope you will do the same. By doing so, we believe we can make Mount Sinai Queens an even better hospital, Mount Sinai health system a better system, and I commit to you that we will do better. This is our opportunity as a hospital and community to reflect on our place in creating a more just and equitable city and country. And now, we we'd like to spend a few minutes answering some of your questions. So I'm going to turn it back over to Judy.
Thank you. I'm now going to ask Dr. Mazo some questions that were shared by our community. Dr. Mazo, it's mid-June and we still haven't seen a second wave. Are we still anticipating a second wave of COVID-19?
So this is one of the questions I get asked the most often. And it's a difficult question because it depends on how much all of us as New Yorkers adhere to the mitigation strategies that we were talking about. Social distancing, wearing masks in public, and hand hygiene. New York City has been employing a rated, responsible, four-phase reopening process that's been guided by data. It has been guided by the testing results and the hospital capacities. We entered phase 2 this past Monday, and phase 2 allowed some more opening. Offices, some retail, salons, playgrounds, outdoor dining, all at about 50%. So again, we in New York are trying to do this in a measured, reasonable, slow and safe manner. Unfortunately, we've seen cases increase in other states, specifically in the South and in the West, and some of those states open more quickly. And when we see pictures from those states, it seems that people are not practicing the safe practices of social distancing, as well as wearing masks and the hand hygiene. So we are quite hopeful that in New York, by opening slowly and by being responsible, that we will avoid having a second wave. Now, that doesn't mean that we will have 0 cases. We will probably continue to have a few cases, but the goal is to keep it a low, manageable number so that all of those patients can be treated. And so if it goes through the community, it will be a slow amount so that we can have the development of treatments and of vaccines. Here at Mount Sinai, Queens, we are ready in case there is another surge. We are ready with supplies of ventilators, personal protective equipment, medications, other necessary items. And the key thing that you all should know is that we are quite confident that if we do see another increase in cases in New York City, it will not be like what happened at the end of March and in April. We are confident for multiple reasons. Mostly, it won't come up as a surprise the way it did, which is what allowed it to spread so quickly. There is so much more testing in New York City as well as here at Mount Sinai, Queens, that we will see if cases start to increase before we are hit the way we were with the first surge. Also, now we have some experience. We know which of our surge plans worked and which needed some tweaking. And so we are more prepared than we were in March. Importantly, each of you can play a role in preventing a second surge. And again, that is social distancing, wearing a mask if you cannot social distance, and generally reducing the spread of COVID-19 in our communities. I have my mask right here. So for when we go out and when I'm closer than 6 feet, I'm ready with my mask covering the nose and the face.
So the next question is, we want to support local business. Is it safe to eat restaurant takeout as well as sit in the outdoor restaurant spaces that just popped up?
So these are good questions. Coronavirus is spread through respiratory droplets, and it is not spread through food. So takeout, pickup, things along those lines, definitely safe. Make sure if you're gonna go pick up, you wear your mask, and that you wash your hands when you come back in after you've touched anything and before you eat your food. It's also good for general food safety. You should always wash your hands before you eat your food. So it's very exciting that starting on Monday, we now do have these outside places to eat. But it's key to be careful when you do this. You want to go and only sit at your table with people who you've already been around and quarantining with. You need to wear a mask except when eating. The staff should be wearing masks if possible. If the staff comes back after taking your mask for eating, put your mask back on when you're talking to the staff. And it's really important for the tables to be more than 6 feet apart. And I will admit, as I walk around Astoria, they're not all more than 6 feet apart. So it's really important that you evaluate that. Also to do sort of similar things as we talked about with our waiting rooms, which is trying to avoid waiting. So if you can book in advance, that would be good as well. And again, make sure to wash your hands before you eat.
Can I just add something, Dr. Mason?
Sure.
It's also really important not to share utensils and not to share your food. So those are all good suggestions that you had for how to stay safe, but still enjoy and support the restaurants that have been especially hard hit during this time.
Erin,
Thank
yes.
you. Next question is, should I be tested for COVID-19?
So these are all the questions that I get asked every day. So first thing to make sure that we're clear about is when people say tested for COVID-19, there are really two types of tests. There is one that is a test that looks for DNA, that looks for particles of the virus. And that test is to look for active infection. The most common way that that test is done is by doing a swab of your nose. Say it's comfortable, but it's not painful. And I have had these swabs, so I'm speaking from personal experience.
We all have.
We've all had these swabs. So again, they are, you
You wouldn't look comfortable,
a
right?
little uncomfortable, but
It's
not
not painful.
exactly. And so yes, and so those swabs are looking for active infection. And so when to do those swabs would be if you had symptoms, or if you were exposed to someone with symptoms or who you know had COVID. We also right now in New York City definitely encourage that anyone who wants a test, who wants a swab to see if they have active infection, is encouraged to get the test. The city has a bunch of clinics that you can call or sign up online to go and get the test. If you are at your doctor's office, an appointment, then you can request your doctor as well to do that test. So that's one type of test, to look for active infection. Then there are also these blood tests that you might have heard about, antibodies. Those look for proteins that your body makes in response to having had the infection. So those tests are not about whether you have the infection right now. It's about whether you had the infection usually 2 to 3 weeks ago. It usually takes about 2 to 3 weeks to make those proteins. So those tests are really to see if you've had the infection in the past. We are still learning about whether those proteins can protect you in the future from getting COVID again. So the big thing that I recommend to everyone, even if you've had COVID, either shown by having had one of the positive DNA, the positive PCR tests, or by having the positive blood tests with the antibodies, you still need to practice all of the mitigation strategies with wearing the mask, social distancing, washing your hands, because we're still learning about this virus. And although we have not seen people who have been reinfected, it is still new, and we're still learning, so you still need to protect yourself.
Thank you. And the last question is, I keep hearing on the news that it's better to be outside than inside if you're meeting other people. Why is that?
So the reason why is that when you're outside, it is much easier to socially distance, and it's harder and it's less likely that you will touch the same things that someone else has touched. So the way COVID spreads, you get the respiratory droplets in your mouth, you speak, you cough, you sing. If someone else is within 6 feet of you, they can then get those respiratory droplets in their mouth, nose, eyes. Or if someone has just coughed right on this table, I put my hand here, don't wash my hands. Instead, I just touch my mouth, my nose, my eyes. That is another way that I can get COVID. So when you're outside, it's much easier to be farther away, more than 6 feet. Much easier to stay away from the people who you aren't already spending time with inside your house. And it's also less likely you're going to touch the same spot that someone else had coughed. As well, when the virus is outside, it doesn't last for as long. However, being outside is not 100% protective. So your risk is lower, but it's still there. And so that's why it's important, even when you're outside in the park, walking on the street, to wear your mask and socially distance. We all have to wait at the traffic lights. We all sometimes get to bunch up when you're outside, although it's easier, it's not 100%. So it's really important to still follow these mitigation strategies even when you're outside.
Dr. Mason. That was excellent information, and I'm sure everyone learned a lot tonight. So I want to again thank Karen Schwab and Dr. Dana Mason for joining us tonight. And I also want to thank all of you in our community. I hope you got a lot of good information, and thank you again for joining us, and have a wonderful, wonderful evening.